flow through the heart. The heart is made up of 4 valves: the tricuspid, the pulmonary, mitral, and aortic valves. The right atrium receives non-oxygenated blood from the body's largest veins, that is, the superior vena cava and the inferior vena cava, and pumps it through the tricuspid valve to the right ventricle. The right ventricle pumps the blood through the pulmonary valve to the lungs, where it becomes oxygenated. The left atrium receives this oxygenated blood from the lungs through the pulmonary vein and pumps it through the mitral valve to the left ventricle. The left ventricle pumps the oxygen-rich blood which it has received into the aorta through the aortic valve to the rest of the body. This is how the blood flows in your heart. At point 1, that is the inferior vena cava, you see it receiving the blood now. Also, the point 2, which is the superior vena cava, also receiving blood from the head region. The blood it's receiving is deoxygenated blood from the head region. While the point 1, that is the inferior vena cava, receiving blood from the lower part of the body, that is the legs, the abdomen. Then it takes the blood it has received, that is the point 1 and the point 2, takes it to point 3, known as the right atrium. The blood which has entered the right atrium now pass through the valve, tricuspid valve, which opens in one direction. It now enters into point 4, known as the right ventricle. Now, the right ventricle pumps this deoxygenated blood it has received into the point 5, known as the pulmonary artery, through the valve known as the pulmonary valve, which opens in one direction. It now pumps the blood to the point 6, known as the blood vessels, that is the pulmonary arteries going into the lungs for oxygenation. That is at point 6. Then the oxygenated blood from the lungs now enters into point 7, known as pulmonary vein. When the oxygenated blood from the lungs enters the point 7, known as the pulmonary vein, it now returns into point 8, known as the left atrium. From the left atrium, it's sent to point 9, known as the left ventricle. It passes through a valve that opens in one direction, known as mitral valve. From this point, known as the left ventricle, is now pumped into the great aorta, through the valve known as aortic valve. From the great aorta, it branches off from the tree to supply the upper region of the body and the heart itself, while the last point, pointing downwards, supplies to the general body. From there, the deoxygenated blood will now start collecting back again to return to the lungs for oxygenation. Auscultation of the heart. As we explained in the previous lectures on auscultation, it is expected that you have performed all the preliminaries that is expected to be done, obtain informed consent, and prepare the patient. The heart and lungs can be examined together, known as chest examination. But however, in some examination, you may only be required to perform heart auscultation. So in this lecture, we are only going to perform or discuss on heart auscultation. Auscultate the heart chambers with the diaphragm of the stethoscope in the following positions: A, P, T, and M. A stands for aortic area, P stands for pulmonary area, T stands for tricuspid area, and M stands for mitral area. Auscultate the heart chambers with diaphragm of the stethoscope in the following position: at right side of the body, second intercostal space at the sternal border, known as the aortic area, listed for the heartbeat. To the left side of the body, place the diaphragm of the stethoscope between the second intercostal space and listed, known as pulmonary area. Then proceed to the left, also the third, fourth, and fifth intercostal spaces. This is where you locate the tricuspid area. And finally, at the fifth intercostal space, at mid-clavicular line, you get the mitral area. While listening to the heartbeat, note the intensity, rhythm, and splitting of sound on each event of the cardiac cycle. Remember, what you are listening for is the heartbeat as the heart valves open and close intermittently. So you are listening to the heart valve closing and opening to detect abnormalities or stress or disorders within the chambers or within the valve. Okay? Always remember, it is important to ensure that your patient is comfortable and understands the outcome of his examination. Auscultation of the heart proper. Use the diaphragm to examine at the upper, lower left sternal edge, that is the tricuspid area, and the upper left pulmonary area, and the right aortic area sternal edges. Use the bell to examine low pitch noises. You use the bell to get the low pitch noises, particularly at the upper, for the mid-diastolic murmur of mitral stenosis. Time the sounds and murmurs. The first heart sound known as the S1 just precedes the upstroke of the pause, and the second heart sound is known as the S2. Okay, and this second heart sound is out of step with the carotid pause. So for you to actually dictate, you just have to, when you're listening, you can hold the carotid arteries and monitor. So the first heart sound known as S1 follows the upstroke of the carotid pause, while the second heart sound is never in line with it. Okay, the presence of third and fourth heart sounds always comes before the first heart sound. Okay, listening for radiations of systolic murmurs over the base of the neck. That is, you want to check for aortic stenosis. Previously, we just checked mitral stenosis by using the bell to auscultate the apex of the heart. We want to check for mitral stenosis that produces the murmur. But this time around, we want to check for aortic stenosis. We now auscultate the base of the neck. Okay, that's within the aortic area. Then listen over the left sternal border with the patient sitting forward. Okay, this is to check, we want to check for aortic incompetence or stenosis. Then if you want to check for mitral stenosis, you ask the person to sit forward, okay, or roll over while you roll over to the left side of the person. The person should now roll over in the left side while you now place the bell of the stethoscope on the upper side of the heart. That's within the fifth intercostal space, while you listen for mitral stenosis. Okay? Heart sounds. The S1, like we said earlier, is the first heart sound, and it is the lob sound. It is known as the lob sound. It is associated with the closure of the bicuspid valve and the tricuspid valve. So you hear lob when the bicuspid valve and the tricuspid valve has closed. And this is usually single, and you are bound to hear this sound loudest at the lower left sternal border. Lower left sternal border. That is where you hear the first heart sound, the lob sound, which indicates closure of the bicuspid and the tricuspid valve. You're bound to hear it at the left sternal border. The second heart sound, known as the S2, is known as the dub sound. It is associated with the closure of the aortic and the pulmonary valves. It usually not appear single due to inspiration, but in exhalation it is single. That is the first heart sound, known as the lob sound, which is the closure of the bicuspid and the tricuspid valve respectively. These valves lead to lob sound you hear, and it's usually single. Then the second heart sound, known as the dub sound, is the closure of the aortic and the pulmonary valves. You know that the pulmonary valves, the valves that close between the left ventricle and the left ventricle and the pulmonary trunk. The same way the aortic valve. So their closure processes the sound known as the second heart sound, dub. It usually don't appear as single sound, dub, during inspiration, but in expiration, it appears as single. What we're trying to say, human being breathes in and out, in and out. So when you are in inspiration phase, you can hear, when that person in the inspiration phase, you can hear the sound as splitting, maybe the okay, or if the person is in exhalation phase, you can hear it as dub. So that's how you identify it. Then the third heart sound is heard immediately after the S2. That is, immediately after the closure of the aortic and the pulmonary valves, known as second heart sound, which is the beginning of the diastolic phase, and is related to rapid ventricular filling. It is best heard at the lower sternal border or apex, and may be a normal sound, but a loud S3 is abnormal, and it's usually heard with dilated ventricles. Okay? So what we're trying to say is that the third heart sound, you may hear it very faintly due to rapid filling of the left ventricles. Okay? Because once the S2, that's the dub sound, which shows the closure of the aortic and the pulmonary valves, then there will be filling of the ventricles through the atrium. When the tricuspid and the bicuspid valve opens, the aortic and the pulmonary vein valve closes. While whenever the pulmonary and the aortic valve opens, the tricuspid and the bicuspid valves closes. Okay, so that is why you be hearing lop dub, lop dub, lop dub, lop dub, lop dub, lop dub, because it actually signifies the synchronous closure and opening of these valves. We have systolic phase and diastolic phase. We know that systolic phase is the contraction phase, while the diastolic phase is the relaxation phase. Okay, so lop, which is the first heart sound, is as a result of closure of the tricuspid valve. And when this closure happens, the next sound you hear is dub, which is the opening of the tricuspid and the bicuspid valves. Okay, I want you to get this. Lop dub, lop dub, lop dub. The lop is the first heart sound, and it's usually heard immediately the tricuspid and the bicuspid closes. These two valves we are saying now, whenever they close, you hear lop. Whereas these two ones, the aortic and the pulmonary, once they closes, you hear dub. So once this one closes, this one opens. So it occurs intermittent, like this one. Once this one is closing, lob. This one is opening. Once this one closes, this one is opening. But the only sound you will be hearing is the closure of these valves and not the opening. What you will hear is the closure of these valves and not the opening. So that is why you hear locked up, locked up, locked up. Immediately the tricuspid valve don't lock. As it don't close, lock. The aortic and the pulmonomic will open. You will not hear it. That lock, closure of the tricuspid and the bicuspid, causes opening of the aortic and the pulmonomic valve, and blood begin to leave. Whereas the hearing of dot, which is the closure of the aortic and the pulmonary vein, leads to immediate opening of the tricuspid and bicuspid valves. So as this one closes, this one immediately, this one is closing, this one is opening. Immediately this one is closing, this one is opening. But the sound you hear is the only closure of these valves. Now, whenever there is closure of the tricuspid valve, that is the tricuspid and the bicuspid valve, it actually means that the aortic and the pulmonary has opened. As they have opened, they will start to contract to allow the blood to move into the general circulation and to the lungs respectively. So diastolic phase, which you said is the resting phase in the heart, clearly indicates that the ventricles are not contracting at that point, whereas diastolic indicates that they are what? Contracting. Okay, so we'll talk about diastolic phases as the resting phase, and it usually begins once the aortic and the pulmonary valve have closed, because once they have closed, it actually means that the tricuspid and the bicuspid has opened, allowing blood from the artery to fill the ventricle. At that point, the ventricles are not contracting, and that is known as the diastolic phase. Immediately, the the valve, tricuspid, closes, limiting blood flow from the artery to the ventricle. The aorta opens, and at that point, the ventricles will now enter systolic phase, which is contraction. It will now begin to contract to pump the blood out of the ventricle to the general circulation. I hope you understand that we say that the diastolic phase usually is the resting phase, and it do come because the aortic and the pulmonary valve have closed, while the tricuspid have opened, allowing blood from the contracting artery to push flow into the ventricle. At that point, the ventricle is resting, and that is known as diastolic phase. But immediately the tricuspid closes, the aortic opens, or the pulmonary vein opens. They open immediately. At that point, the ventricle now, which have accumulated blood, will begin to pump, contract to push this blood out to the general circulation. So this is what happens. Okay? So this is what happens. That's how systolic and diastolic phases are detected. And how the lockdown is dictated is that the lock is the closure of the tricuspid and the bicuspid valve, which is the beginning of the systolic phase, contraction phase. Then, while the door, which is the closure of the aortic and the pulmonary valve, is the beginning of the diastolic phase, that's the resting phase for the ventricles, because it will not allow inflow of blood. Then once it closes, this one opens and contraction begins. So that is systolic and diastolic phases. Now we're trying to say that since the lob is the first heart sound, closure of this tricuspid and bicuspid valve, then the dub, which is the second heart sound, the closure of this aortic and pulmonary valve. Then the third heart sound occurs or is heard immediately after the second heart sound, known as the dub sound, which is the closure of the aortic and pulmonary valve, which is now the beginning of the diastolic phase of the ventricles. So it is heard immediately, there is closure of this valve, and it is heard in the diastolic phase. Okay, so that is immediately after closure of aortic and pulmonary valves, which is the beginning of the diastolic phase and is related to rapid ventricular filling. So you hear that third heart sound fainting. It requires your ear training for you to detect it. Because of that closure of that aortic and pulmonary valve and opening of the tricuspid valves, there will be rapid flow of blood into the ventricle. So because of that rapid flow, it leads to that noise known as the third heart sound, and that sound is usually known as ta. You may hear lock doctor, lock doctor, lock doctor, lock doctor. That ta is the third heart sound. But when this third heart sound becomes loud and excessive, it is as a result of dilation due to maybe high blood pressure or anything that is causing the left ventricle to expand or widen unnecessarily. Then the fourth heart sound. The fourth heart sound occurs late in the same diastolic phase. That is, during the filling of the ventricle, it also occurs. Okay? Just before you hear the first heart sound. That is, this fourth heart sound occurs just before the closure of the tricuspid and bicuspid valves. And it is best heard in the lower sternal border. And it is as a result of ventricular compliance or ventricular issues, hypertrophy, that's widening as a result of the hypertrophy, excessive enlargement. You hear that sound known as ta. So you may hear ta, lock doctor, ta, lock doctor, ta, lock doctor. The ta before the lock is the fourth heart sound. While the lob is the fifth heart sound, the dub is the second heart sound, while ta is the third heart sound. So you may be hearing ta, lob, ta, ta, lob, ta, ta, lob, ta. Okay, so that is how you identify the heart sounds. Another abnormality that can be detected from heart auscultation outside murmur includes clicks. A click implies valve abnormality or dilated great arteries. Okay, so you might hear a click. Okay, so the murmur is known as the third and fourth heart sounds. Alright, these are murmurs, heart murmurs. But a click usually is as a result of issues with the valves. That flap of muscles is issues with muscles, whereas murmurs are mainly due to left ventricle problems. Okay, and these clicks are best heard at the lower sternal border. Okay, it is often louder at the apex, left medial sternal border, or right upper sternal border. Okay, the clicks, you hear it due to incompetence of any of these valves. Possible findings. First heart sound is usually single, that is the lobe. It is as a result of closure of the mitral or bicuspid and tricuspid valves. When this sound is heard more louder, when it is heard more louder from the lower sternal border, ideally you expect to hear this sound at the lower sternal border within the apex area. Now, if you now auscultate the pulmonary area and you are hearing, if you auscultate the pulmonary and the aortic area, you are not hearing more of the first heart sound locked there more than in the lower sternal border. It can mean hyperdynamic circulation, that is anemia. Pregnancies can lead to that. Mitral stenosis. These are the conditions that can lead to louder first heart sounds. Then, when the first heart sound is now soft than expected in the lower sternal border, it can mean that the heart is failing, because it is the ventricle that has the highest contraction force. It can mean that the heart is failing, or there is regurgitation in the bicuspid valve of the left ventricle. Then, second heart sound. Second heart sound. This is as a result of aortic and pulmonary valve closure. Okay? It might actually indicate arterial septal defect when there is fixed wide splitting. You know, this second heart sound usually splits with inspiration, but single in expiration. So, but when the splitting is now much in a baby or in a child, you may suspect arterial septal defect. Third heart sound. The third heart sound is a low pitch, often heard as a gallop. It is as a result of ventricular wall abrupt cessation of rapid filling. It can be normal in young people to hear this sound, and also you can hear it in pregnancy. But it can also mean disease. In heart failure, you can hear it, and in mitral regurgitation, you can hear it too. Fourth heart sound is also a low pitch, often heard as gallop. You can only verify it. Is as a result of stiffened ventricle or hypertrophied ventricle, and it usually indicates left ventricular hypertrophy. Clicks are brief high intensity sounds. It is usually due to valvular aortic stenosis, valvular pulmonary stenosis, or mitral valve stenosis. When you hear stenosis, just narrow in. The valve can no longer open very much wide. So the blood that is now passing through the valve will now be making that noise. That is why it's known as click. Okay? So that is the pure sign, and it usually indicates maybe a thickened or calcified valve. Okay? It's a thickened, the valve has become calcified, that it has lost its compliance in opening and closing. So these are the things you are to identify as abnormalities in heart chamber examinations. Okay, aside checking for the intensity and the reading and the rate of the heartbeat. So the heartbeat is a pure indicator that someone is still alive. So these are the things the S1, the S2, the S3, the S4 helps to identify abnormalities. So this is the level we can go for your class. Thank you.